You know, the one thing that we can't forget is the clinical response to the care of a positive patient with COVID-19. I recall just the emotion for both our providers as well as nursing staff. In particular, the response to folks being here, patients being here without their families.
So my name is Stephanie Richard, and I work here as a nurse on PCU unit right here at NMC.
And how long have you been here?
Actually, I joined NMC back in February.
So right in the middle of things.
Yes, it literally hit 2-3 weeks after I arrived. Yes.
And where did you work before? Tell me about your experience in nursing and...
South Florida, mostly. I've been there for 20 years. Work oncology, ICU, step down, different areas, different leadership roles. So I had just left the leadership role to come back to bedside nursing.
Wonderful.
Yes.
You like bedside nursing?
I was missing it after a while. I like to kind of go back and forth. So it was time for me to go back to bedside nursing because this is one of my first passions. So.
Wonderful.
Yes.
That's cool. So I want to jump right in because I know that our time is short. So start by telling me about the level of PPE you were wearing and what it was like to sort of go into a room with that amount of stuff on. Maybe you want to describe, because we got to assume our audience have no idea what we're talking about when we say PPE.
So we had to wear N95, so we were fitted for that. So we knew which size we had to use. Also, we had a visor that we had to wear and a cap that we would also have to put on, and then we would put the gown and 2 pair of gloves. So every time we encounter entering a room into a rule out COVID or a possible COVID, this is what we would have to wear.
So what was it like to have that much stuff on and do your normal job?
At first it was difficult because you get to sweat a lot under that you start dripping, literally. Your visor gets a little foggy, so it's kind of hard to see. You kind of have to kind of bend a little bit to find a good spot where you can see things. So it's an adjustment at first, especially the amount of time that you're in the room depends a lot on how much you're going to sweat and things like that. So it's definitely something that we weren't used to, for me especially. But eventually you get used to it. You find little tricks to kind of make it okay for the duration of the time you're in the room. So.
Yeah, I bet it was an adjustment.
It was a challenge.
Were there any little tricks that you could share? Things that you were like, oh, if I do this, I'm more comfortable?
No, I just tried to hydrate myself more because I realized that I tended to sweat it a lot to the point that sometimes I was getting a little lightheaded at times. So I kind of encouraged myself to drink a lot more when I knew I was going to work in those areas of high COVID or rule out COVID situation, like on PCU West, and just kind of snack at different time and not just wait. Usually, you know, I don't eat breakfast and then lunch comes when it comes, you know. It's not something you could do very easily. So you kind of have to nibble throughout the day, and that kind of helped me also not to feel so dizzy, overheated, and things like that. So
smart. Talk about being in the room. What was it like? As I understand it, it was maybe not always easy to hear.
No, PCU West had these big made, I'm not sure how you call them, you know, but it was very loud. So we kind of realized that it was a little difficult to hear through the doors. So we started writing on the window glass. So we would write our vital signs. We would write things that was happening at the time-wise, so people could see on the other side. We would write what we needed, so then they could read it and pass it through to us, because otherwise it was very loud and difficult. Yeah, even if you were glass to glass, it was like, what? Yeah. It was tricky. So there we started doing that, writing everything on the glass.
Smart.
Yes.
The things you think of in the moment because you have to, right?
Exactly,
yeah.
Yes.
When you say you wrote on the glass, did you have to write backwards for the other people to see?
Well, I started practicing writing backward because it was easier. So it was kind of, for me, it was a little easier to write backwards. So I started just writing that way so people could see exactly what I needed. Sometimes I didn't have the time, so I will just scribble really quick and, you know, in a little more emergent situation, and they will be able to kind of code what I wanted, and then they will bring or keep notes of what was going on in the room.
That's amazing.
Yeah.
You're in like full PPE,
Yeah.
hot, loud, taking care of sick patients,
Yes.
and you write backwards.
Yes, try to.
That's amazing. Talk about patient care in this scenario. What was it like to be, I mean, I imagine that you worked with some patients who were maybe very sick and some patients who were not, but what was that like to care for these patients?
You had to be very organized, because once you go in, you go in. There's no back and forth. And yes, you had a runner, but it's not somebody you want to have constantly going for little things. So I made sure that before I entered the room, I had all the supplies, all the linen, medication, everything that I needed at the time, and then I will finally enter the room. When you went in, you really had to do everything you could do at that moment, because you don't want to spend, you know, too much time either to expose yourself, but you want to be efficient, go in, do what you got to do, and then exit the room. So it will be medication, vital signs, you know, bathe the patient, change the linen, do everything you could do, so when you get out, you had a little time to recuperate also. So we will usually, if you're missing anything, there was a runner waiting at the door for you, so you will let them know, I need this, I forgot this, can you bring me this? So you had to cluster everything, and you had to be extremely organized to care for these folks. So
And you, I mean, you've been an ICU nurse for how long?
for quite a few years, yes.
Did this feel different?
Oh yes, absolutely. Because when you take care of an ICU patient without COVID, you don't think about you that much. You know, at the end of the day, when you learn COVID, it's a new situation, it's a new way to do things. It's a new fear of also being exposed to it and taking it home to your own family. So it makes you think a lot more. It makes you really think through everything step by step to say, oh, hopefully I did everything right so I don't expose myself or my coworkers or even my family when I go home, knowing I spend the day caring for somebody who had the disease or maybe still ruled out, so you don't know, you know. So it's definitely changed your awareness, your care, very much so.
Well said. You have a long drive home. What were those drives home like when you were done a shift here? And how long were your shifts?
Our shift was like 12 hours. The sad part is I was literally in Vermont, locked here. When I first moved in February, the plan was for us to live in Vermont. We were looking for a house, getting settled, and then COVID hit, so I had to make a quick decision into my family going to Canada with my children and me staying here. So I was here for 4 straight months without seeing my kids or my husband. Yeah.
What was that like?
Scary. Sad. I'm sorry.
It's okay.
It's a sensitive topic.
How old are your kids?
10 and 11. Just turned 10 and 11. It was hard to be away from them for that long. Knowing that you're dealing with the COVID, it was good and bad. Good because I didn't have to go home and possibly infect my family if, you know, that could have been. But also very lonely. Thank God I had an awesome coworker, Lois, that took me to her house and gave me a room for me to stay for that whole time. And then we just became really, really good friends. So to this day, I'm very grateful and thankful for her.
She was pretty wonderful.
She's awesome. To this day now, this winter, I stay with her when I come to work now. I was allowed to go back home after I make different changes to go back and forth now, because this is not really where we live, but we didn't have time to settle over here. So we got in that mix of everything. So I had to put my children in school in Canada right now, and that's why now I go back and forth. Bought a vehicle in Canada. So I am Canadian, my husband is Canadian, so that's what kind of saved us. So when COVID eventually goes away, hopefully, and the borders reopen, we will continue looking for a house here and reroute ourselves.
Oh, good. I hope so.
Yes.
Can I ask a question?
Yeah, sure. Go for it.
Do you mind sharing the experience of when you finally got to go home?
Oh, it was unbelievable. It was nerve-wracking. Very sweet.
What time? When would it have been? Was it?
It was on July 14, which was exactly 4 months to the day. Yeah. That I saw my kids. Yeah. It was really sweet. My kids would, my oldest one would be crying a lot, calling me, asking me to come home, knowing, you know, that I couldn't right now because I had to be here and do what I know what to do also, you know, what I was meant to do. So it was hard. It was hard. They still have some anxiety when I go to work, wondering if I'm coming back or if it's going to be longer again, you know. So there's some anxiety there that got built over the years, you know, over time, over the month, because of that. But yeah.
And they're old enough, I mean, they really probably could understand.
They understand. I left, yesterday we went to bed and my little one told me, Mommy, you know, like, thank you for all you do. I know you do a lot and it's not always easy. But yeah, definitely, they recognized that I had to help some sick people and people needed nurses to help. They know that if all the nurses would have got scared and ran away, who would have taken these folks? That could have been me, my kid, it could have been anybody's family member. So they understand that part. It was just hard to know that Mommy wasn't going home for that long at that point. So that was hard for them.
Oh my gosh, I can only imagine.
Yeah, that was rough.
So did they meet you at the border that day?
No, I told my husband, I remember saying, don't tell them I'm coming home. They weren't sure, you know, like they know we were working on something and tried to, you know, make it work. But then my husband couldn't keep a secret, so they were all waiting for me at the house when I got home, and they were crying and said, finally, you know, you're here. So yeah, it was very exciting.
So what was the first thing that you did with them? Did you like make pancakes or just?
We just snuggle. We snuggle. We watch like a good show on TV and we just snuggle with blankets, and we did that on the first day. Like it's like the clock just stopped. It was nice just to, you know, hug both of them and just don't do anything, you know, just hang out. It was awesome.
Very nice.
It was great.
And so now are you working shifts where you're like here for several days and then you go home for several days?
Sometimes I am. Like usually I do days in a row, so 3 days. So I'll come like this morning, I will come to work and then I go to Lois' house, sleep there. And then on my last day I drive home. So sometimes I'm here for 3 days straight, sometimes I'm here for 4 days straight. And then I go home after that and spend time with the kids.
Goodness,
with school and homework and everything.
Oh, the homework, right?
Yeah.
Oh, goodness. I wanted to ask you what you thought was the hardest part of all of this. Maybe we've already touched on that, though. It sounds like it might have been being away from your family.
That was hard, but at first it was to face what COVID was about, to know that, wow, this is something you can get. This is something you can get very sick of. I mean, you heard in the news with New York and the nurses and the physician being so sick. Some people were lost, you know, not only patients, but staff members. And it kind of go through your head too, especially for me who was locked here, hadn't seen my children, and say, what about if I get that? If something happens to me, if I get on the vent, like, is that the last time I saw my kids is when I came here on March 14 with my backpack with all my clothes? That was the big fear. So for me to be very cautious and careful and, you know, it was very important because this is not something I wanted to happen to me or my family. So it was always in the back of my head when I was entering a room, the fear was there. You know, but you just had to overcome it and do what you knew how to do, you know, just go in and take care of these folks.
It's amazing.
Yeah.
How did you feel that we did here? I mean, did you feel supported? Did we have good systems? What was it like to be at NMC in this?
I think it was well organized. You know, I think at the beginning, I remember the rooms were being set up. You know, you're coming into something that it's really unknown to a level. So you try to do the best, but everybody was on board. We had great training on putting on PPE, removing PPE, how to help each other out, to do certain things, how to team up together when we knew a patient was not a one person, you know, care, but needed two to move, to turn, to do everything. So I think I was very well supported. We saw Dina on a regular basis in PCU. Our leadership was awesome. The help was there. Things we learned on the way that we didn't know, and we just made the changes and went ahead and kept going, you know, and I think it worked out pretty well.
Good. I'm glad to hear that. It seemed that way from sort of the outside looking in, but it's nice to hear it from somebody who was in the thick of it.
Yes, no, and it's reassuring if there is a second wave to know that how we did on the first one will be okay on the second. You know?
That's such a good point, especially these days, right? With when you look at what's happening across the country right now, it scares me.
Yes, yes.
That was all the questions that I had. Is there anything we didn't touch on that you wanted to speak to? Anybody you want to give a shout out to, or anything that's just like, you know, what was your big takeaway from this?
I mean, the big takeaway is we learned a lot. We learned something that we didn't really expect to live as a nurse, but I really think as nurses, we definitely were made to encounter these unplanned disease and things like that, and the only way to make it through is with teamwork and have everybody on board and do the best you can. And then, you know, we're all in together at the end of the day, so it's just to take care of these patients that we know how to do it, just adding a different layer to it, you know. And that's my thing for me that I'm proud of, you know, because it takes us to do it all together and be successful to that. And I think NMC definitely was successful.